Good afternoon, everybody. Today we have Jason and Paul with Zing Health. They are going to go over their 2025 product information with a fairly large expansion for this year. So I'm going to ask them all the questions for your benefit. And then if I miss anything, these fun little QR codes right here, I'm sure are going to take you to Jason and Paul's contact information so that you can ask them more detailed questions. But outside of that, I'm going to give it to you guys and y'all can take it away.
Excellent. No, thank you, Courtney, and NCC. As an entity as well. Thank you all for taking the time out of your day to hear what we have to say, because we really are pretty darned excited. And I'll give Paul here the floor before we get too in depth on things. Paul, you want to introduce yourself, and then we'll kind of take it from there.
Sure. Thank you, Jason. My name is Paul Richardson. I am the regional account manager for the state of Tennessee and also Mississippi. So we are very, very excited that Miss Courtney and all the people with NCC have given us an opportunity to help you grow your business. And so it's just my job, and with Jason's poking and prodding to make sure everything gets done according to the way that Zing Health wants it to get done. We're going to make sure that we grow your book and just have a good time doing it. So thank you so much for the time, and look forward to working with you. Back to you, Jason.
Yeah, no, that's great, Paul. And Paul's one of our newest members of the team. Really excited to have him there in Tennessee and Mississippi. Just done a wonderful job right out of the gate. Knows the industry well. He's been in the business for a very long time, as have I. We've both been brokers, by the way, out selling products. So we have intimate knowledge of what you all go through on a day-to-day basis. I started Zing Health back in 2020. The inception of the company actually came about in 2019, however, in one lonesome county in County, Illinois, Chicago, to be exact. And when I joined, we decided we were going to, jump in headfirst into a couple of other expansion states and kind of launch the 1099 channel. And since then, I'll tell you what, we have seen tremendous growth as we found our footing in not just general enrollment space, but more precisely in the CSNP space. And as you all know, the landscape of SEPs is changing in 2025, especially in that LIS and Medi world. And so what you're going to see is some compelling reasons, I'd say, to ensure that you kind of lean into the CSNP space, because you're going to have an opportunity to sell these plans year round. And again, like I said, we'll dive in a little bit more to that. But what you see in front of you here is Dr. Whitaker is our founder and CEO, and in 2017, when he kind of came up with this idea, and he always kind of jokes how he came up with the name Zing. He was in the shower, which is where he does some of his best thinking. He jokes, but it is a catchy little name. Sometimes you'll have to kind of get over that hurdle as a new carrier into the space. But we are entering our sixth season, so excited about that. Key differentiators for Zing Health in all of our markets, quite honestly, not just in CSNP, but also in general enrollment spaces. We really lead our markets that we're currently in with competitive drug pricing, free key medical devices, and supplemental benefits such as grocery, OTC, card, transportation, and whatnot, that really speak intimately and to the social determinants of health and impacting those. Dr. Whitaker is born and raised in Chicago, and so he's had firsthand knowledge over his life of witnessing things such as food deserts, right? Access to care issues for a number of different reasons, and so he's very thoughtful, as he launched this company, and then as we started to really focus our attention into that CSNP space. So today we're going to kind of talk a little bit about, again, our vision and strategic overview, again, around differentiated product designs. But I think probably most importantly is a leading customer experience, where we use a lot of partners to offer wraparound services, and then also to kind of get in front of things as folks not only on board with us, but then as they start to realize that, the access to their benefits is wide open with Zing Health. They can use their food card from day one. They're not having to wait for that verification or anything like that. And transportation, again, on all of our HMO products. We have an integrated care delivery system that, again, uses in partnership some of those vendors. We'll talk about those later today in the presentation, but really ensuring that, a smooth transition onto a plan. We all know that sometimes, that can be a little hairy, right? So we'll touch on that. And then also robust sales and marketing, which really speaks directly to what you do out in the field, because let's face it, quite honestly, when a beneficiary is in front of you and you're, putting Zing in front of them, you are the face of Zing. It's not Paul. It's not myself. We are, just a small piece of the puzzle. But they're really putting their faith in the company through you. So we'll spend a lot of time on the educational piece, as well as offering, our support to you as you're out in the field. Now, in terms of our overview, I mean, we are regional. And again, we're 6 years old. So those first couple of years were pretty rocky, right? Trying to get folks' attention and brokers out there to, not only understand our path and our focus, but, simply just to kind of dip their toe in and write an application or two. But I'm really excited to say that in January 1st of 2023, so let's go back a year and a half here or more, we had about 3,100 members. And at the beginning of this year, January 1st, 2024, we had tripled in size to 9,600 members. Well, I'm really excited to say that, since February of this year until July, we hit 13,000. And actually, as an organization, we've had our busiest months in the last 3 months and we built on that, out of any month ever in the history of the company, outside of AEP, of course. So we broke our record in June, we broke it again in July, and we did it again in August. So tremendous growth. And that's during lock-in. Imagine, right? Like, we have seen the most growth as an organization during the time when most agents or at least some of them anyway, are taking vacations, catching their breath, getting pulled, in different directions in terms of certifications and learning about the new products. And yet we're growing at a tremendous pace. And most of that is in the SNP space. We do offer D-SNPs in Michigan, one of our current states. And then we offer dual focus plans in our C-SNP products in all markets. And that's how it's going to be in 2025 as well. Here's just a real high level idea of our expansion. And, as a regional carrier, opening 3 new states in 1 year is tough enough for a large carrier, right? A national carrier. But we're doing it. We're doing it really well. You'll see county expansion in Illinois, Indiana, and Michigan, where we're doubling our footprint in counties. We're going to be in the Cleveland and Akron marketplace, as well as Nashville, and then Memphis, and again, across the border into Mississippi for 2025. So in terms of the product portfolio, this is a great idea of really kind of, what we're offering in all markets almost. I mean, the PPO will kind of, you'll have to be a little more strategic with the PPO in certain states, but we offer HMO products, HMO PSP. We'll talk about what that provider-specific plan and strategy looks like here momentarily. As I mentioned, D-SNP plans as well in the HMO and PPO space there in Michigan. But along the bottom, this is, going to really kind of show you how deep we go into the C-SNP space with HMOs, HMO PSPs, dual focus HMO C-SNPs, and PPO C-SNPs, and also a dual focus PPO C-SNP in Indiana and Tennessee. Now, something else that we launched over a year ago was an ESRD C-SNP, and that's very unique in the marketplace. You just don't see MAPDs focused in that C-SNP category on the ESRD condition. But we found footing in that space. We're doing a great job of providing care and really strong benefits. Now, it's a small percentage of the population, but again, you're going to see here momentarily why you need to consider that when you get out there and run into folks with end-stage renal disease. Now, like every carrier, we have to, identify different buckets where we want to kind of put our money, right? And, pretty typical in the space, right? $0 premium plans. We have PPO, cost share parity, which is a passive PPO, some folks will call it, where, whatever you pay for a copay in network is going to be exactly what you pay out of network. Of course, we go really deep into that food and utility benefit. And if we're not leading the pack in all of our markets, we're definitely coming in at 2. But right now, in the 3 states we're currently in, we lead the market in all of our service areas. We have some CSNP enhancements for 2025, which again are kind of focused on the OTC food and utility benefits, but also a very unique Part D Tier 6 formulary that is a 0 copay for some really key CSNP related drugs, lower specialist copays and really quite honestly, it's $0 copays for specialists, for CSNP specific specialists. So a really great chronic meal benefit. We have some allowance improvements to include flex cards on most of our plans, all of the HMO products, and then some competitive MOOPs. Now, we all know that, rarely, it's a very small percentage of people reach their MOOP in a year's time. But strangely enough, folks like to, shop based upon what their maximum out of pocket, trying to, reduce that exposure to risk. Now, in terms of our plan types, again, I've already mentioned HMO and PPOs there on the left, the D-SNPs, the C-SNPs, the dual focus C-SNPs, and then the ESRD products. We're going to cover these at a high level, but I'm still going to show you the grids for all states. But let's take a step back, kind of look at, again, how focused we are in that C-SNP space and identify, again, some of those key categories, such as transportation on all of our HMO products. The $0 copays, as I mentioned earlier, of the CSNP specific specialists. We offer that Tier 6 formulary, as well as a Tier 1 $0 copay formulary. Something else that I'm really proud of, and we've been actually partnering with PAPA for the last 3 years, and that's been a key driver in our strategy. And PAPA, if you're not familiar with them, provide in-home support services such as transportation for errands, light housekeeping, meal prep. They even help you understand technology. Heck, in the Chicagoland area, when we get snow, they will even shovel your sidewalk. I mean, that's how extensive it is. And that benefit is on all plans for our HMOs and our CSNPs. Now let's talk real briefly about, why we got into the space, because Dr. Whitaker identified the need early on, but it wasn't until our actuaries looked at the numbers and said, hey, wait a second, there are about 32 million Medicare Advantage beneficiaries across this country. Yet, and the prevalence of the conditions that you see there, diabetes, chronic heart failure, and ESRD, is high, right? Like, look at those percentages. They're 12, probably 13, maybe even 14 million by now. These numbers are a little old, I'd say maybe a year and a half is where we had this as far back as we could go. But on the right-hand side, 600,000, less than 1 million people are actually enrolled into a CSNP. Yet there's, 12, 13, 14 million people with a chronic condition, but they're all enrolled in general enrollment plans. They're not enrolled into a CSNP. So imagine that. They're not in a plan that's designed to better help them treat their condition, to help them live healthier and happier lives with benefits that are strategically designed to treat their condition and create a roadmap for them, again, to become healthier. And that benefits the members, as you can see here. Providers love it. In our current footprint, as soon as they identify a Zing patient and member, they actually start to engage with us at a higher level, and we do with them as well. We are a very tech-forward company when it comes to sharing data. And then brokers, as I mentioned, year-round sales opportunities with lower churn than the D-SNP space. And then again, those differentiated product benefits. Now, I mentioned, the enrollment periods, right? Because I'm not sure if everyone really understands, how impactful this is going to be for 2025. But, the LIS population, the DSNP population, are going to be very limited throughout the year moving forward when it comes to enrolling in a different plan. Should they make, have a change in their health, maybe they made a poor decision and they want to get out of it and try something else. With the CSNP products, you can enroll folks year round in 2025, right? Based upon the condition that they have. It even includes, when I always tell people, when the pencil drops in December 7th, right? And no one else can write any business with the CSNP plans, you can actually continue to write business all the way through the end of December. So, if someone calls you on December 8th and they say, hey, you know what, I made a bad choice, or I didn't quite get my selection in on time. Can you help me? Well, if they have a chronic condition, they're going to be able to enroll into one of our plans. And lastly, if you look at the growth year over year, DSNPs are that darker line there. And, let's face it, I mean, the DSNP space is crowded and a lot of carriers really chase that business for years. But it really wasn't so in the CSNP space. In fact, most CSNPs are not really richer in benefits, and they don't do a great job of actually treating the conditions, quite honestly, than a general enrollment plan. But this last year, CMS got it. They saw the path and they understood it. And quite honestly, Health did too. And so we launched our products in 2022. We were part of this growth, this 42% year over year in the CSNP space. And that's going to get more dramatic this upcoming year. I guarantee you, with those reductions in the SEPs. Real quick, let's pivot back to kind of plan design though. We've got PSPs. I mentioned those earlier, right? We have HMO PSPs, we have CSNP HMO PSPs, provider specific plans. They work on a narrower network of primary care physicians. And the reason for that is that we actually partner with value-based care entities such as Oak Street Health. In fact, I think it's every single county that we actually do business in for 24 and in 25. There's an Oak Street Health clinic where a PSP plan, like we're mentioning here, is offered. So if they enroll into a PSP, it's going to have a little bit richer benefits, but they're going to have to go to their primary care for Oak Street. Now they can see a specialist within our network, that's outside of Oak Street, but again, they must go to a value-based care PCP. Now, in terms of our dual focus CSNPs, and let's talk about that briefly, because these folks, you got to make sure they have that QMB plus or QMB plus, SLMB plus, those full benefit dual eligible folks. They cannot have a spend down, and it varies state by state. So you have to be intimately kind of up to speed on what your state is offering, with the HIDEs and the FIDEs and all of this stuff, right? It's a lot of education that you have to do so that you can help your folks get into the correct plan. But let's remember, with our dual focus CSNPs, you want to make sure that they don't have a spend down. Otherwise, they will be exposed to that 20% co-insurance, okay? Now, it goes without saying, we also have CSNPs where you don't need Medicaid, though. And that's really been the big boon. If you can imagine the people just above those income thresholds, right? There's a ton of people out there on fixed incomes that don't have Medicaid, that don't have LIS, and they're hurting. They're hurting bad. Prices are going up and their incomes are staying the same. And you're going to get that opportunity as well. So a quick overview of the ESRD plans. Again, I mentioned these are very unique in the marketplace. And just a few years ago, someone with ESRD couldn't even get into a Medicare Advantage plan, if you remember correctly. Well, we launched this last year. It's been very successful in Indiana and Michigan. So the two states that we actually launched this with. And if you can believe it, these plans offer $0 copay for dialysis and nephrologist visits. So again, and remember, and just they don't have to have Medicaid to be on this plan. So imagine someone above those income thresholds I don't know if you've priced out a dialysis visit, but I have, and it runs even at that 20% coinsurance between $150 and $200 a visit. And sometimes people go to dialysis once, twice, even 3 times a week if it's really severe. So imagine the savings that someone realizes once they get onto this plan, not to mention unlimited transportation as well for dialysis. I mean, that's a key driver, right? In getting someone to dialysis. They go through that 3-4 hour process, however long it takes them, and then they can't drive after that. They are exhausted, so they need transportation, and this has again been a winning recipe for us in this plan. We also offer PPOs. Again, they're passive. In and out of network cost share parity. We also have combined in and out of network MOOPs as well. So very, very competitive in the marketplace, and they do serve a need. As I mentioned, 3 new states, 18 new counties. We're in 43 total counties with a 40% increase in total addressable market. We are hitting it hard, and it's only because of the foundation that we've built in the space. In terms of our plan names, there is a little bit of, thought put into that, right? You'll see on the left the plan types that we offer, but there are key words that are associated with those plan types. So if you kind of scroll down past the HMO and PPO plans, you'll see the PSP. Well, there's a key word of elite in there, right? So if you are kind of doing your searching and you come across our HMO and PPO and it has the word elite in it, that those are the types of plans where someone's going to go to Oak Street Health for their primary care, and so on and so forth. Now let's take a quick peek at all the states, and I'm going to again hit this high level because quite honestly, all of our plans are very similar across all of the markets. We're not just hitting this year with some strong benefits, right? Just to find out next year, you got to go back and have some pretty serious conversations with folks because those benefits have changed. In fact, since our inception, our benefit and plan designs have only gotten better and more strategically designed. And that's, again, part of our winning recipe. Okay. So you'll see here in Illinois, we're adding Kendall County, but we've got the entire Northeast, all the way from Kankakee up to the Rockford area and Winnebago covered for 2025. And again, quick overview, we have our general enrollment plans at the top to include an HMO, PSP. We've got our CSNP plans, which include a dual-focused plan, but yet remember, the other ones, you don't need Medicaid to get into those. And then that ESRD product at the bottom, again, you don't need Medicaid to get into that. Notice we've done a lot of county expansion on all these plans to make sure that we're offering these to as many people as possible. In terms of the key benefit highlights, I won't spend much time on here because we've already touched on some of them. But I do like to point out, right, like we've got transportation on all HMO plans. We have $0 insulin on every single plan, not just the CSNPs. So remember a couple of years ago when the administration announced $35 insulins across the board for all Americans? We were already ahead of the curve there. We had already started offering $0 insulins on all of our products before that even happened. And we're going to continue that for 2025. We have $0 copay for some CSNP specific specialists, and we list those in the bottom right corner there. So imagine endocrinologists, gerontologists, nephrologists, ophthalmologists, podiatrists, cardiologists, and pulmonologists. Folks that suffer from diabetes type 1, diabetes type 2, cardiovascular disease, chronic heart failure, ESRD, they see these specialists at a higher rate throughout the year. And sometimes a copay gets in the way of that. That's why we have $0 copays for those 7 specialists. We also have $0 copays for mental health, substance abuse, and psych on various plans as well. Chronic meals on all CSNPs. And just to take a quick peek at the grids, and again, I'm not going to spend much time on these, and I'll send this out to the NCC team, and they can share this as well. But general enrollment plans, okay? These are plans that folks can age in and enroll into. These are going to be big players during AEP. But you can see the PSP plan on the left, the regular HMO on the right. Look at the specialist copays even on those, $10. I mean, these aren't C-SNPs. These are just regular HMO general enrollment plans. To include dental, vision, and hearing, the Flex card on both plans, inpatient hospital copays of as little as $200. And then let me explain something at the bottom here. We have OTC and the food and utility card, right? So if you look down here at the bottom, you're going to see on the left-hand side, the OTC is carved out from the healthy food and utility. And we do that very, very thoughtfully. So the reason why we do this is because you have to have LIS. We file these benefits as a VBID filing on our general enrollment plans. So the member must have LIS to get the food and utility card on this plan, but we didn't want to take the OTC benefit away from them at $198 a quarter. The food benefit is monthly. Those don't roll over on any of our plans, but they can be very competitive on all plans in all markets for 2025. As we look at the C-SNP space, right? Check this out. I mean, again, PSP and then the regular C-SNP, very, very competitive on all copays. You'll look at the specialist copays here at 10 and 15, but remember below that are the C-SNP specialists at $0. And again, we list those on the right-hand side here. All of our plans have dental, vision, and hearing. Those flex cards are additional spend on any of those benefit categories once they hit those maximums. And all of our dental, vision, and hearing start with $1. So no one ever has to pay a single dollar for preventative or comprehensive, nothing out of pocket. And if they hit that max, again, they've got a little bit of cushion there with the flex card.
And Jason, on the flex card, is it fair to say that you can negotiate cash prices with your provider and pay using that card?
Yeah, but listen, that's true. You can do that. Here's some of the nuances of those flex cards and why I think I've heard some carriers have kind of gotten burned on those in the past, though. So I want to just kind of address that right now. Someone can use those flex cards whenever they want, right? And a lot of times when a beneficiary, a Zing member, walks into a doctor's office, a dentist's office, and they say, oh, I've got this insurance card, because our members only get 2 cards. They get their health membership card, and then they get a flex card that includes their OTC, includes their healthy food and utility benefit. It's a MasterCard, right? And sometimes they'll show that. And then all of a sudden the dentist says, oh, well, heck, let's exhaust that benefit before we even tap into these other dental benefits. And that's the exact backwards thinking that some, offices will take, an approach they take. So make sure that we're mindful having those conversations with our clients that, hey, listen, when you go in, you can show them the Zing card, but remember, the vendor they use, the insurance company they use is actually Liberty Dental. So we do have Liberty Dental as our provider for dental. We have Nation's Hearing for vision. Nation's Hearing for hearing benefit. And gosh, I'm losing my train of thought there on the vision, but man, Paul, help me out here if I don't remember this, but it'll come to me later on. But yes, they can negotiate, to your point, they can negotiate cash prices off of that flex card, but I encourage everyone to use their dental benefit first, Courtney, before they start using that flex card.
Fair.
Now here we go with and pardon me, I can't see the very top of my screen, so I can't read what this particular C-SNP is. If you could help me out. Oh no, this is the dual focus plan. Look at this. The PCP, the specialist copays are either $0 or 20%. That's why we want to make sure that those folks are full dual eligible with no spend down. Otherwise, they're exposed to these cost shares, to include LIS, right? They got to have that LIS status as well for the Part D. But on these dual focus plans, I mean, again, dental, vision, and hearing, transportation. Now, this is where things are different on these C-SNP plans, even the ones I showed prior. We filed those instead of through the VBID where they have to have LIS. They don't have to have LIS with these plans necessarily. Now, this is the dual focus plan. They certainly would have LIS, you would think. But on any of these plans, we filed them through the SSB BCI benefit filing, which means all they have to do is have a chronic condition, and they get this combined benefit of OTC, healthy food, and utilities on a monthly basis. It doesn't roll over, but if you can imagine annualizing this, 170 times 12, right? If you get it in front of a couple, a husband and wife, imagine the impact that makes on someone's lives to be able to access those benefits on a monthly basis. I mean, that's true. That's a true realization, right? Of benefits, and it impacts every single member on our C-SNP plans. Again, I wish I could move some of this stuff here. I believe this is this the ESRD plan, Paul? I can't see it at the top there. I think it is. But anyway, we've got maximum out of pocket of $49.50. And then again, even on an ESRD plan where you're paying for unlimited dialysis and unlimited transportation, none of the other benefits are degraded. We don't take anything away from these folks. They even have a flex card of $500. They got the food and utility and OTC benefit of $175 a month and unlimited transportation. Real quick, I'm going to show you all, providers in all service areas. But in Illinois, this is our backyard. I didn't mention this, but we are based out of Chicago. That's where we're founded. That's where our offices are. All of our customer service teams come into the office. They're all stateside. There's no one from a call center across whatever ocean, right? They all speak English. We have bilingual reps. And so we come to meet our folks, where they need to be met, right? And understood. But here's a great snapshot of what our networks look like in Illinois. It's extensive. And this is kind of how we get into a market, these new markets, right? We're not going to have everyone like what you see here in Illinois, but we have a small but mighty network team that we have a smooth process. Whereas if you see a clinic, a provider, a hospital system that you don't see it in network, we encourage you to work with our regional broker managers in our markets. It's a one-page form, and they go after, and aggressively they go after, folks that are not in network. So I always like to remind folks of that. Now let's pivot real quick to Indiana. We do have a service area reduction there, Allen County. Just couldn't seem to get things, it's a 2-hospital system there, and it was just a tough road to hoe the last few years. So we're pulling out of Allen, but we're circling Indianapolis, adding Madison and Morgan as our final 2 counties there. And we're in Northeast Indiana in the Gary area, in Lake County and Porter counties. So big expansion here, lots of great things. Again, you're going to see a huge, offering here. And I would like to point out that in Indiana, we have PPOs. So we have a local PPO in the general enrollment space, as well as a C-SNP PPO and down there at the bottom, and a dual focused PPO as well. Again, more of the same here. I don't think we need to spend too much time on this. Again, I'm looking at the PAPA benefit, just so you all know. We give PAPA, again, on all plans between 30 and 60 hours a year. We go to the general enrollment space with the PSP HMO on the left, the regular HMO in the middle, and then the PPO on the right. Again, more of the same. I think that what you're going to see as we hit all these states is it's just more of the same. There's nothing really that, is an outlier. And we do this very purposefully. The reason why we do this and keep the same supplemental benefits across all markets, across all service areas, is so when you're out there talking to your client and they're trying to make a decision on what Zing plan they want, they'll never have to give up their transportation or their OTC or their flex card to get, into a particular plan. They're always going to have the same plan design on every plan. Now, the PPOs, I will mention, do not have transportation for 2025. That's the only thing where we actually kind of pulled back on. But again, we were very thoughtful in our spend and making sure that, listen, if you're in our network and using it, you're going to get transportation. Here are the C-SNPs. Again, you've got, the PSP C-SNP on the left, the regular C-SNP in the middle there. Again, no Medicaid for these. Same with the PPO C-SNP on the right. Incredibly competitive all the way across the board. 30 one-way trips on transportation on those HMOs. And look at the SSBCI benefit at the bottom of 174, 172, and 167 even on the PPO. Again, annualize that, and that's a huge spend for someone. Here's the ESRD plan. Again, more of the same across all markets. $500 flex card, 175 in their OTC food and utility benefit. Here's the dual focus C-SNP here, where we've got an HMO and a PPO, right, with expansion counties there on both. Again, very, very thoughtful in the plan design. Be mindful that the PPO does not have transportation. And in terms of provider partners, we have 4 of the 5 biggest hospital systems in Indianapolis, and we just brought on SHO, the Suburban Health Organization, for all of our regional hospitals in and around Indianapolis and all of those additional counties. So we're really excited about that as well. And here I also want to point out, not just Oak Street there at the bottom, but we have DaVita and Fresenius in all markets in network. So keep that in mind when folks are talking about dialysis, if they've got ESRD, they go to both. Turning over to Michigan briefly, again, we've been in the Detroit area in Wayne, Oakland, and Genesee County for the last few years, but we're doubling our footprint to Macomb, Livingston, and Washtenaw this year. Really excited about expansion in Michigan. And you'll notice here, general enrollment plans, again, HMOs and PPOs, but we also have that other category of D-SNPs in Michigan, which is a little unique in all of our footprints, as well as the C-SNPs and the ESRD C-SNP. Again, I mean, I really don't have to talk much about this slide other than to say another thing to point out. If you look down a few bullet points there, you'll see routine podiatry is offered on all plans. You might say, well, that doesn't really, so what? Well, actually, that is a big deal. Routine podiatry is not covered by original Medicare. Not sure if you knew that. Now they can, seeing a specialist, a podiatrist, yeah, that's covered, right? That's a Medicare covered service, but routine podiatry is something that a lot of folks, even if they're not suffering from diabetes, where foot care is so important, they suffer from, flexibility issues. It's hard to take care of your feet. We offer between 4 and 6 routine podiatry visits a year at zero copay. And we've been doing that since day one as a company. And it's proven to be a very effective way in helping people, again, and meeting them where their needs are opposed to saying, oh, you got to, you got to work through our rules and you got to pay out of pocket if you need that. Not with us. General enrollment plans, more of the same, PSP. So remember Oak Street, kind of specific plan on the left, regular HMO and the PPO on the right. Again, these dollar amounts are very similar to what you see in all the other service areas. Very competitive on the RX at $0 copay for tier 1, $5 for tier 2, 47, 33, and 33. By the way, we offer sildenafil as a tier 2 medication on all plans. Here's our C-SNPs in Michigan to include our regular PSP C-SNP, our regular C-SNP in the middle, and then our PPO C-SNP there on the right. And then here is our, this is our ESRD C-SNP. Again, more of the same, more of what you've already seen. We got our rebates back at the beginning of August, and guess what we did? We just continue to sock money into those over-the-counter food and utility benefits, and we added flex cards on all of our HMO products. Here are the D-SNPs. I think those are something that are kind of like, a thing of the past, but they're coming back in Illinois in 2026, surprisingly, or not surprisingly, I guess, if you know that market. OTC, again, carved out with the VBID, the folks with LIS. Look at the D-SNP. They get $188 or $147 if it's an HMO or a PPO. We've got Corewell Health, Tenet, University of Michigan, Ascension. We got a couple of other ones that we can't mention yet, but we're excited about what's going on there. So again, once we kind of get our foot in the door in a space and the physicians and the hospital networks kind of see our strategy and see how impactful they are, those barriers start to, break down. Let's pivot to Mississippi. Go down south a little bit further. We're going to be in DeSoto, Marshall, Tate, and Tunica for 2025. We'll have HMO only products in the Mississippi space, the PSP and the regular in the general enrollment. And then again, we go deep into that C-SNP space, right? More of the same here. Won't even spend any time on that. We've got general enrollment plans down there, HMOs on the left, the PSP on the right, the regular HMO. Now on the PSP, be mindful here. Look at the service areas. It's only DeSoto County. Now, why is that? Well, it's because Oak Street Health is in DeSoto, but they're not in Marshall, Tate, or Tunica. So that's why we have that PSP in DeSoto only. But they get a little bit better benefits in some of the benefit categories. You get 40 one-way trips, right? But very similar again, a little bit more OTC, lower specialist copay. But otherwise, they're very similar. Here are the C-SNPs, the PSP again, Oak Street, think DeSoto County only. They're on the left. On the right, all 4 counties. Remember, they don't have to have Medicaid again for this product. And then here's the ESRD plan, more of what you've already seen. And then here's the dual focus. So remember, this is all filed at 20% and 25% for the RX. Make sure they got those Medicaid levels proper. Going back up north, we got Ohio. We're excited about Ohio this year because we're in Cuyahoga, Lorain, Lake. I think it's, I'm forgetting how to pronounce it. I think it's Goja, Portage, and Summit. Yeah, thank you. And then we've got the HMO products there in the general enrollment and HMO products in the special needs plans. We do not have PPOs in Ohio as well. Get over that one and get right into the general enrollment plans. Again, PSP and HMO. Here's the PSP C-SNP, as well as the regular HMO C-SNP. We have our dual focus there as well. Our ESRD. And we're leading the way with Cleveland Clinic as our main provider in the Ohio area. So that's going to be a tough one, in my opinion. There's just a couple of hospital systems there. Cleveland Clinic is a great partner, and they're going to really help us get into that market. But again, just want to be mindful of that. You will see additions to this network slide as we get in there and grow.
Was there a question?
Courtney?
Paul, I just said that Cleveland Clinic was huge. That's a huge provider in that area.
It is. And you know what? Let me talk real quick about our network. We actually, we have, as you can see already, HMO products, right? With a little bit of PPO here and there. But something that I just found out recently and had no idea about is, let's say someone's living in Mississippi, right? Down there in DeSoto County, and they have one of our plans. But let's say they're traveling up to the Cleveland area, or they just want a second opinion. They can go to Cleveland Clinic. And if we have an open network across state lines, across county lines, you can go, to Rush Hospital, to Northwestern, to, anything in Chicagoland if you want. Usually it's for a second opinion, but that's a nice feature as well. Now in Tennessee, we've got 3 counties, just 3. Little old Davidson's up there by itself there in the Nashville area, but we're excited about them. But more importantly, I think this is where, Paul, has been working for years, is that Shelby and Fayette counties. And we've got HMOs and PPOs in those counties. Now, you'll notice on the right there on service areas, the PSPs are Shelby County only because Oak Street is not in Davidson or Fayette County. So the PSP and the general enrollment at the top, and then the top C-SNP plan, Shelby County only. Again, think Oak Street on those. Again, more of the same all the way across the board. Here's our general enrollment plans. Nothing new. Here are our C-SNPs, right? We got our PSP on the left and Shelby only, our regular C-SNP in the middle, and then our PPO C-SNP there on the right. Here's our ESRD plan, just like the other states that we've covered. Here's the dual focus plans. So again, make sure they got the full those full benefits on the Medicaid side. And then here are providers. For Memphis, we have Methodist, Regional 1, St. Francis. So we're a little deeper in that space, right? Nashville got HCA and Nashville General at Meharry. So we've got some work to do there in Nashville, but there's a path. There's a path. Okay, I know we're kind of winding up an hour. I've got a bunch of more slides, Courtney, but let me just kind of flip through a few of these, just a real high level, point out that we have zero copay for nurse advice hotline and telemedicine. At the bottom here, we have a rewards and incentive program where folks, again, pretty kind of standard in the industry, but they can earn additional money where they can spend just about anywhere if they get their colonoscopy, their mammogram, their yearly checkup, that type of thing. Here's a quick oversight of or overview, I should say, of our over-the-counter partners, the Walmarts, the CVS, the Walgreens of the world, as well as a ton of grocery listed here as well. So they can go there. They can also order OTC items through a catalog as well. They can also do that with food. We offer fitness memberships on all plans, Silver and Fit. We offer a voucher for a free membership to Weight Watchers. If you price that out, it's over $100 a year. Dietary and nutritional counseling, as well as medical nutritional therapy. We got the POPA at the top. We offer PERS on all of our C-SNP products. And then something else that we've had since day one as a company, bathroom safety devices. Typically, these things are high ticket items in OTC in the catalogs. Think shower wands, grab bars, shower benches, things that are higher ticketed items. We offer 2 of those to every single Zing Health member every year. You can get up to 2 at zero copay. And that doesn't come out of your OTC. It's a carve out. The utility allowance covers electric, gas, heating oil, sanitary, and water. Remember, it does not include gas at the pump. But if they get those reward and incentive dollars, they can actually use that at the pump. So if they get their mammogram or their colonoscopy, that one MasterCard will work if they want to spend it that way. Something else to remind you of, again, as I mentioned, we got transportation on all of our HMO plans. But just keep in mind that even on the PPO plans, they can use their PAPA benefit as a transportation service as well. Just scroll down to the bottom here. I guess in the middle, we do have 10 post-discharge meals that we've always offered, but this year we're also offering 28 meals for folks with chronic conditions. They meet with a dietary nutritional, like a nutritionalist. They identify their nutritional needs and what their restrictions are. And then those meals are designed to kind of, again, address those restrictions. And they get 14 meals at a time sent to them, up to 28 in a year. As Dr. Whitaker is out in the, he's out there talking to agents and brokers. And in our first couple of roadshows we ever did as an organization when I was out there in 2020, agents said, "Hey, what about Viagra? A lot of my clients, want Viagra." So we added it to the formulary mid-year, actually. And so he always jokes, that we're here to put the Zing back in people's lives. But it is true. They get between 4 and 6 tablets a month, depending on what state they're in. So I challenge anyone to use that many tablets. Something else that we did since 2022, and again, this is on all plans, is we've offered $0 copay for CGMs, continuous glucose monitors. That also includes all of the supplies that go along with that, the adhesives and everything. $0 copay. Now, this is typically in a DME category, which they can get because we partner with ADS, but they can also just get a script from their physician and take it right to the pharmacy. And they can get their CGM right at the pharmacy if they want. They don't even have to go through DME. It also partners with pumps. So we offer Libre Freestyle, Dexcom 6, Dexcom 7. So the leading brand names in the CGM marketplace. But we also offer a pump at a tier 3. So it's only $47 a month if you want an insulin pump. Price that out and you'll find that that's usually, north of 150, pushing $200 a month for an insulin pump. So that's a key seller as well. Now, here's where it gets juicy. $0 copay for insulins, I mentioned earlier, right? Look at the extensive list of insulins we offer. We don't just pick a couple of them. Now, this isn't inclusive of all insulins, I'll admit that, but it is pretty extensive, and it even includes the pens, the injectable pens. And then something else to get excited about, we currently have this year in our CSNP products. So it's not like this is a shiny, just the shiny, benefit for 2025. We've already been doing this. We have a tier 6 on all of our CSNP plans. Look at what they can get at $0 copay. And this is going to be really impactful this upcoming year, because guess what? You all know that coverage gap's going away, right? The donut hole is no longer. So they can, think about a member in a CSNP plan, right? They're taking one or more of these medications, brand name meds. They're also seeing their specialists at a higher frequency. Think about the savings for those folks, again, that are above that LIS and Medicaid levels, the folks that don't have any help. Think of how much of an impact you can make when they're spending hundreds and hundreds of dollars out of their pocket every month to treat their conditions. I mean, Januvia, Ozempic, Trulicity, it's crazy. But it's a winning recipe. Now let's real quick pivot, and we're going to bring it on home now. We use Evolve as our broker portal. This is where you do your contracting, you do your certification, you track your book of business, and you look at your statements. But just as importantly, here's where our sales and marketing piece comes in. We have TGI Direct as our marketing partner, and our marketing team is just on top of it. They really are. They offer, and we offer brochures, flyers, postcards, thank you cards, holiday cards at no cost to you guys. And you can personalize them and put your name and phone number on them only. And we'll print them up and send them directly to you at no cost. You also want to make sure you get your pre-order for your 2025 materials. Those are going to be shipping out here on and around the 27th of September. We even have a Facebook social media guide and it shows you screenshot by screenshot how to set up a business account. And we have CMS approved drip campaigns that are focused on CSNP, focused on food card, focused on LIS, focused on aging in. And we take you step by step on how to do that. We use Ascend as our online enrollment tool. If you go to our website, that's where you're going to be directed. But we also work with Connecture and Sunfire, and we even take good old-fashioned paper. If you go to zingfirstlook.com, all those grids that I showed you earlier, as well as a bunch of other information, is already posted online. zingfirstlook.com. And this is where we'll bring it home. I'm not going to spend a lot of time on this, but these are our wraparound services. Advanced Diabetes Supply in the middle, City Block, Strive Health, Perry Health, and Story Health. All of these providers engage with our members at a higher rate to help them treat their conditions. Now, there are some exceptions to this. If someone's going to Oak Street, for instance, their value-based care, they're not going to get contacted by any of these companies. But ADS is a great partner. You already probably know this if you work with them, that, it doesn't matter if you enroll them today for an October 1 start date. You can call them up immediately and they will call that beneficiary today and they will make sure that they have the diabetic supplies that they need prior to even becoming a member of Zing. They're a great partner. City Block, wraparound services around kind of more of a primary care, but they offer nurses, social workers, doctors, mental health providers, but they just basically help us work in step with their current PCP and to create a roadmap even outside of the CSNP space. Because guess what? We have Perry Health to do that for our diabetics. So they reach out to all of our folks suffering from diabetes and help, again, create a roadmap for better treating their condition. Story Health does it for all of our cardiac members. They even offer scales, blood pressure monitors, things like that. It's very, very important, I think, for folks if they're suffering from these conditions and they don't really even know what they have a lot of times, but to understand how to treat them and how to better control them. And then Strive is a great partner around ESRD. So as you can see today, we cover the entire gamut, right, of products and supplemental benefits as an organization, and we mean it. We actually walk the walk. Now, you don't see Paul's name up here, and I'm sorry I don't have that slide up, Paul, but you had his QR code earlier, but we have people in every single market. Alex Gutierrez in Illinois, Sarah Newman, Indiana, Ryan Combs in Michigan. We're in the final stages of adding someone for Ohio as well. And then there I am on the left. I cover all markets. You can scan these codes and get all of our contact information and reach out directly. We even have a marketing outreach team. We have people in every single market. You can contact these people. They're out marketing brand awareness. We're doing the diabetes walks, doing the Alzheimer's walks, doing the health fairs, and they're creating opportunities for brokers. So if you want to get plugged in to events, we are solely focused on the 1099 channel here. We don't have W-2s. We have a few in Illinois, just a handful. Everywhere else, and even in Illinois, we have far more events than we can even manage. And that's no joke. So if you want to sit events and do grassroots marketing, think of us and come to us, and we will work in partnership with you to grow your book of business. Again, here's our QR codes of Paul and mine. Really, I just want to thank you for sitting through what is, a little more than an hour of your time, but we're there at the end. Courtney, do you happen to have any questions for me or Paul?
I don't. I think you covered it fantastic. The CSNP is, for lack of better wording, going to be the new DSNP as far as enrollments are concerned. And honestly, a lot of the DSNP clients fit the CSNP mold, and they'll actually get a whole lot of more benefits that will actually help them be healthier in the long run with a CSNP plan. So these are some really cool, very niche products that I think a lot of agents will be able to add to their portfolio.